Hello friends, welcome back to my channel. And those who are new, let me tell you, my name is Shalu. I'm a dentist and basically from India, and I have cleared my ORE exams here in the UK. I'm happy to help you through your ORE journey, so you can send me your emails if you have any queries. I would like to get back to you. Okay. I have received so many questions regarding the Dental Manikin exam in ORE Part 2. So today I'll be taking you through the consortium. This is the document which is freely available on the site. If you go to the ORE Part 2 exam site, it is the guidance there. Okay, so I'm taking you through and I hope I'll be answering most of your questions. And still, if you have any doubt, don't worry, you can always reach me at my email. And this is a little bit introduction, professionalism domain, clinical domain, professionalism, communication and management and leadership domain. The full range of knowledge, skills, attitude, and behaviors that are contained within these domains of PIP are examined within the four components of all these exams. Okay, so this is basically what is expected from this. This is the level that GTC is expecting you to have. Okay, so if we talk about dental mannequin, the scope of examination is that dental mannequin is, of course, it's not a patient, but you have to first and foremost, as well as when you will be sitting for the exam, the examiners, they will be assessing your operating position, which is very very important with a real patient, and all appropriate cross infection control procedures. You may not be getting any, you may not be transferring, getting or giving any disease to the mannequin, but you will be assessed on that basis. So basically you have to treat the mannequin as your patient. All right. And this operating position, this is very important in maintaining. Four-handed dentistry is what is practiced here in the UK, and that is what you should achieve. Although you will not be having any assistant, but as a dentist, you should be, everything should be in your reach. You should be at the back of the patient. So we'll talk about it in some other video, but it is something which you need to achieve. And this position, it depends, your operating position depends on which tooth are you operating on, right? Yeah. So the next comes as information and instructions. So it is just a mechanical test of your clinical skills and it is simulated test. Ability to complete the exercise to the satisfactory level of competence, good clinical judgment is justification, choice of material. So basically what this is in detail telling you what you should be doing there. They are the clinical skills which you should do is, it means your ability to complete the exercise. Depending on if you're using amalgam, then your preparation has to be for the that material. If you're using composite, that has to be as per the composite. I hope I'm clear about that. Okay, so this is, these are the clinical skills. And of course the safe practice means you are treating the patient mannequin as occupation while doing, your back should not be hurting. Okay, all the candidates, they are observed by the examiners during the examination to ensure that they can practice safely. Okay, that is what is needed. Examination needs, there will be three exercises which needs to be completed in 3 hours. Two of them will be major, and the, why are they called major? Because of their complexity and the time we needed to complete. They are the larger exercise, bigger ones, and one of them will be minor one. Okay, and a standard equipment, set of equipment will be given to you. I hope you are, you, if you are, you have given ORE1 and you are preparing for ORE2, I hope you are familiarized, you know what it is, and it's given at the end of in the appendix as well. You can have a look there. Artificial teeth will be used over all the exercises, of course. Yes, you know which teeth they are using. For root canal test, candidates will be provided with pre-operative radiograph. Okay, the lead examiner will explain the arrangements for taking additional radiographs. You may have to take. All right. All the treatment procedures must be carried out with the model mounted in the phantom head except where otherwise directed by the lead examiner. So means you cannot take it out in your hand. The way during exercise, during practicing, we take it out and we see it and we make the minor adjustments. You cannot do that. So you know that, yeah. Before the examination start, what will happen is when you will go inside, you will be wearing the full PPE kit, and then you will be briefed by the lead examiner on the details of the exercises, and then second briefing will be given by one of the skills lab staff on the mannequin and the equipment. You will be the people there, the examiners there, they are there to help you. Honestly, they are not going to make that they understand. I mean, but they are there to listen to your problems, and they will be giving you a fixed set of things. All equipments, you'll be informed about all the equipments. You will be given detailed instructions, and then before starting the exam, you will be given a tooth will be marked there as an X. Okay, the tooth will be marked. You will be told that you can practice and check your equipment and practice on that tooth before sitting for the exam, actual exam. Okay. And then comes your examination. During the examination, candidate must complete each exercise and have it assessed before starting the next one. This is the thing. You start with one exercise, you tell your examiner which exercise you'll be doing, and then you finish it, you show it to the examiner, and then you will be starting your next exercise. Okay, not before that. Exercises can only be started after it has been discussed with examiners. I have already told you the examiners will state the stage at which they wish next to see. So when they come to you, they may say you, okay, fine, you have made the cavity, okay, show me the liner. Or you don't need to show me the liner, you just show me the complete filling. So that depends on what sort of exercise the examiner wants you to do. The candidate should complete their stage to their satisfaction and request the nurses to inform the examiner they will be ready to be assessed. The candidates will be seen in the order that they have requested. So what happens in your exam is when you have done it, you tell the nurse, okay, that I want the examiner to come and see me, and there will be a board placed somewhere on the wall in your vision. Of course, you can see that, and the nurse will be putting down the numbers or numbers there, your roll numbers or whatever numbers, so as to identify, like, if I have told him to come earlier than the next person, somebody else, so you will be examiner will be coming and seeing the candidates in that order only. So that is what happens there. That's why you must have heard, if not, then for our exam, you time management is a bit tricky thing. So you should manage your time well, because you may have to wait for some time before starting the next exercise. The candidates will be seen in the order in which they request to see the examiners. Discussions with examiners may include clinical aspects of work, related clinical procedure, and nature and use of associated dental materials. Okay, so these discussions will contribute to overall assessment of each exercise and will contribute towards the assessment of professionalism and communication skills. Okay. Then is any unexpected problem or difficulties which are encountered must be discussed by the examiners before proceeding further. Candidates are not permitted to use their own instruments. Okay, you will get everything from there. You must wear your gloves, mask, eye protection. You may get your own loops if you are in habit of using the loops. White coats are optional, but if you wish to wear one, please bring your own. For health and safety reasons, shoes should be worn which cover the whole foot and should not have excessive heel. That's the one thing. Then comes the equipment. So the equipment which is given there is the Fresaco Typhodon teeth will be there. I hope you all know what it is. It's a bit softer than what we used to use in India, back in India, in our preclinicals. So it's a bit softer. I'll strongly advise to use one of these tooth before sitting for the exam during your practice. Standard burrs will be there. They are all in the list, which I'll show you later in the video. Then there is instruments tray. Tray will be full, standardized, containing equipments appropriate for all the exercises that you need. And if the material, they normally nurses, they are quite helpful and they are quick in providing you the material. But if you need something, you can always raise your hand and tell the nurse to get something else. If you need any other instrument, you think it's not sharp, you think the burrs are not sharp, or any other instrument you want to change, you can tell the nurses and they are there to help you. And what happens on the day of exam? Before the examination, you'll receive a briefing by the lead examiner, okay, about all the three exercises which needs to be done. So everything will be done at the same time before the examination. You will also receive the briefing from skill lab person. Okay, there will be a tooth. I have already told you, with the black cross, which should be used with the practice session. Okay, so what to do in that practice session? I'll briefly tell you what in that practice session you should check your instruments. Okay, You should check the tooth, check the instruments, everything is working, your suction, your everything should be working. So all the instruments, they're fine, they're okay. Your position, your chair is moving up and down, your patient typhodont, you can adjust the height. Okay, so all that you need to check. And at the start of the exam, one of the examiners, they will come to you and they will ask you um, which exercise you want to do first. So that is your choice. You can tell, I'll be doing this particular exercise, and then the examiner will say, okay, fine, you want to do this, show me at this stage. Okay, so this is what happens. And you can definitely ask the examiners if you have any concerns or you do have any doubts or anything. And then during the exam, if you want to see an examiner, please raise your hand and to add your number onto examiner's list. Okay, they will come you in turn as quickly as they can. All right, when you want a material or ask a question, raise your hand again and ask the nurses, they are very helpful there. Okay, and be very careful of which tooth you need to do the exercise on. You are very stressed, so it seems very obvious here, but believe me, the stress level is quite high there and you may get confused. It's something which may happen. So always be very careful, okay? And the time the clocks are there, so you don't have to worry about anything. And there is no break in the examination. If you want to get up and stretch, do it. You want to go use the washroom, but that your examination time is being eaten away by anything you do, okay? A water fountain is there if you become thirsty, if you want to like have water. Talking with the examiner, the time you are with the examiner is the part of examination and is part of assessment of you and your work. The examiners will ask you of your opinion on the quality of work you are presenting, and this is to test your understanding. You especially if you have done anything wrong, let them know that this went wrong, and I know, and now I can do this to rectify the mistake, whatever it is. So that'll be fine. Okay. Examiners may say words fine, okay, good. It's I hope that your work is fine, okay, good. But examiner will merely be indicating that they have completed a particular stage in their observation. Examiners will not be giving you any feedback. So don't listen, don't give much attention to what examiners say about your work there. Okay, you should listen to everything what examiners say, but about the work, you will they will not be giving you any feedback on your work at that very moment. Okay, so don't, if anyone says the user, they don't, they're very professional, so they don't use these words, but in case anyone uses, they have mentioned it, so I thought you should know that. Towards the end of the exam, you complete it, then you may leave. If you complete it, if you're lucky enough to complete it beforehand, and they you will be provided with some feedback forms. Sorry, it's feedback form. You will be provided with few feedback forms. You should complete it. It's regarding it is regarding the system they followed during taking this test. Okay, the facilities, the system, and things like that. Okay, when the lead examiner calls the end of examination, please stop immediately. Okay, put the birds back in the bird stand. Then you may have to leave the room quickly and quietly as possible. All right. Time management is something which is very important here. And all these exercises must be completed within the 3 hours because you're not given any more time, any further time. And moreover, if you want to have water or if you want to talk to examiner, the waiting time for the examiner, everything should be included, and your practice should be in such a fashion, that in such a manner that you exclude all this time and still you're able to finish the three exercises. Okay, if you're feeling unwell or some pre-existing condition is there, please do let the examiners know. That's what they say. Now let's come to the possible exercises. All the exercises, most of the exercises which we do in the general dentistry, it's covered here. For example, amalgam, class 1 cavity, class 2 cavity, okay, on the back tooth, composites in the front teeth, okay, class 3, 4, 5, any of these may come, or restore the fractured cusp, That may also come in the exam. Then is root canal therapy. Root canal, assess cavity, prepare and assess cavity on the tooth provided. Prepare and assess cavity, identify the canals prepared. So if you prepare the assess cavity, then you'll have to make the direct assess should be made to the canals. So all this is done. And of course, use of rubber dam. Nothing is done without rubber dam. Then crown preparation, you may be given some exercise about the crown preparation, then the labial veneer or the temporary crown, fabricated temporary crown for already prepared tooth, or the impression taking. Then it's up to you whether you take the impression as which technique do you use, single impression or dual impression, up to you. That's, you can let them know. Okay. Then is rubber dam placement. Again, you may be asked to place it. And for the partial denture, you may be asked to prepare the rest seat. Okay. Or take a working impression for the removable partial denture. Design the partial denture on the study cast. Okay. All these exercises may be used separately or in the combination. So all these, you'll be asked from among all these things, you'll be asked to do any three things during your exam. Operating position, this is very, very important. From you should sit upright. What should be there? They have written everything here. Read each line of it, and I'm sure most of you must be following this, but if not, just go back to it, read it, and practice with this position. Okay. Hand mirror, finger rest, infection control, all these are very, very important things, and all these, they are related to patient safety, and these are taken very seriously here in the UK. So keep make your habit during the practice sessions, only make your habit of working in a safe way so that you can transfer your these skills into the patients, into the clinical setting. Okay, then comes the assessment. The exercises level of competence. So it is set by the GDC. Okay. And grading system, you'll be marked as exceeds standard, meets standard, below standard, well below standard, or not done. Okay. Exceed standard means clinical work, it fulfills all the desirable criteria which are specified for that particular stage. Meets, it fulfills most of the desired, and it's okay. The work is imperfect but not sufficiently so to be determined detrimental to the health of the tooth. All right. Safe practice, very important. So you have to do all that. Okay. Then professionalism, communication skills, and management and leadership. So all these things, they will be dental manikin. So they will be assessed by the examiner during the talk, your talking, your behavior, your position, posture, and everything in general for those 3 hours. So dental mannequin overall pass or fail. Two major exercises carry twice the weightage than minor. The overall result for three exercises is determined by aggregating the marks from each, which with this weighting incorporated. Okay. To pass the DM component of the examination, candidate must pass the exercises and safe practice section of the assessments. All right. This is basic DM guidance. Okay. And then here comes the appendix for the materials which will be provided to you. It is just the general materials which you must be aware of. I'll leave this link in the description box so you can go and get this PDFs, or you can Google this, the consortium DM guidance, you'll get that. So this is the exercise description. How will you be told about the exercise? For example, class 1, occlusal cavity in upper posterior tooth. They will mention the side, right or left as well. And they will say prepare a class 1 cavity in an upper molar or premolar, whichever tooth they tell you, involving the occlusal fissure and mesial or distal pits. Cavity should be lined as necessary. This tooth or an alternate tooth may be packed with amalgam on request. Okay. They may ask you just to prepare the cavity, or they may ask you to fill it with amalgam as well. And these are the desirable features which you need to achieve and against which you will be marked as exceed standard or meet standard. All right. These are the undesirable features which will lead to lean you towards the below standards. Okay. Similarly, these are the active exercises which may come, and in which way you'll be told about all this in the exam. Okay. So all these steps you need to follow, and you should be able to, by the end, you need to achieve this. Even during the practice session, so here is a tip, even during the practice session, you do the exercise, you finish it, and then you should compare it with this standard. Okay, you open up this document and you start looking for the same things. You should match both of them. If you're getting all the desirable features, you should be sure that you're passing. And if during practice you are not getting, you're missing one or two points, just work on those. All right. So I think this is all for today. Okay. I hope I have answered all your questions. I hope I have answered all your questions. And if not, send me, comment me here, or you